guys, I just finished listening to President Trump and Health Secretary Robert Kennedy's conference on autism, so I wanted to share my thoughts. I'm Dr. Raj, board certified pediatrician. Okay, so I keep politics out of science, and I went into this with an open mind. I would love to know the cause of autism and what we can do to prevent it or treat it. Wouldn't that be amazing? But unfortunately, this conference didn't really reveal anything new. And in fact, there were some things that I think are pretty harmful. So first of all, he had mentioned not to take Tylenol at all when pregnant. So of course, we want to minimize any medications that aren't necessary when pregnant. But if women are not taking medicine to treat their fevers, and there's no toughing it out, fevers can cause birth defects in kids. So that's really not good medical advice. And to tell a woman to tough it out if there's pain, that's not really the right thing to do either. It puts a lot of blame of autism on the mom, and we know this is not true. There is genetics involved with autism, and genetics come from the mom and the dad. So that is the first thing I didn't like. Next, he talked about the Amish population not having any autism and not taking Tylenol. So that's simply not true. There are instances of the Amish population does have autism in their community. Now, their instance may be lower, but that could be for several reasons. If they're not going to the doctor a lot, they may not get diagnosed. They may accept certain neurodivergent factors more commonly, so it's not a cause for concern. So remember, autism is on a spectrum. So I didn't think that was true. Talked about other countries not having Tylenol and not having autism. Again, as far as I know, there is no population that does not have autism. So I think those are harmful words. There was talk about spacing vaccines. Again, I don't want to beat a dead horse, but no evidence has shown that spacing vaccines is helpful. There's no cause between vaccines and autism. And spacing it, I have always thought, is a little bit more cruel, to be honest. You're bringing that baby in several visits, and that's more exposure to whatever illnesses are out there. That's more pain every time they get a shot. And there's no reason to do that to your child. So yeah, there's that. And he also talked about 80 different vaccines for babies. We don't give 80 different vaccines, so I'm not really sure where that came from. Next, he talked about leucovorin, and the way they made it sound, it was like this magic thing that's going to reverse autism or treat autism. I had done a separate post about leucovorin, and I'll put that in the stories, but it's not a magic pill. It doesn't work for everyone. And there's so much still we're finding out about it. We need to look at the risk and benefit. We need more studies. How long does someone need to be on it? What doses are appropriate? So it's not the cure-all. Certainly worth the conversation, but not the cure-all. Within this whole thing, not related to autism, but he also mentioned waiting until 12 to start hepatitis B. I would not advise that under any circumstance. Hepatitis B is not just a sexually transmitted disease. It's through other bodily fluids. And before the vaccine became universal, we were seeing astronomical numbers associated with that. And untreated hepatitis B can cause a chronic disease and hepatocellular liver cancer. So again, there's no reason to delay that vaccine. And again, it wasn't tied to autism, so I'm not really sure why that was thrown in. So the end-all be-all is, I know this hasn't changed. This conference didn't really present any amazing information. At the end of the day, when it comes to what is right for you, your pregnancy, your child, you need to have a conversation with your obstetrician and your pediatrician. And I don't think any major medical societies are changing any of their recommendations based on this. Oh, the other thing he had mentioned is you shouldn't give babies Tylenol. all the time. I don't know of any pediatricians who recommend Tylenol all the time. In fact, most of us say less is more. You don't treat every fever, you treat the child. So if your child is acting fine and they have a low-grade fever, absolutely you can watch. It's a natural immune response. But if they're miserable, they're in pain, their temperature is going too high, then certainly treat. I hope this is helpful. Put any comments below. Thanks.